Welcome back. We're wrapping up our conversation about women's health on this edition of Public Affairs Unpeached. My guest for this segment, Dr. Chanel Harkins from GI Specialists of Georgia, and Joy McAdams with information about a drug discount card that can really help you with some of the things you're going to need to purchase. So thank you, ladies, so much for joining us. We're going to start with you, Dr. Harkins, and talk about women's health. And people often think about, breast medicine, seeing your OBGYN, but there are other things gastrointestinally that we need to take care of as well.
That's correct. We want to emphasize today about the importance of colon cancer screening. This is a problem that affects both men and women. However, women, we really tend to put off our own health. We tend to be the caregivers, and we like to do that, but of course, without taking care of ourselves first, we can't do that properly. So we want to emphasize the importance of colon cancer screening.
And when should that start? When should a woman have a colonoscopy?
Well, for patients who are average risk, meaning they don't have any active symptoms, they don't have any family history of colon cancer screening, the right age would be age 50. However, for those who have a first-degree family member with colon cancer, history of colon cancer, or even precancerous polyps, they should start at age 40 or 10 years before the age of diagnosis. Also, African Americans, we know there are increased risks that they may have colon cancer earlier, so we encourage starting screening at age 45. That's something that a lot of people don't know about.
And there are other gastrointestinal issues that women get concerned with, just ulcers and colitis and Crohn's and things like that.
Absolutely. We see all sorts of common GI problems. Women are commonly affected by pelvic floor dysfunction, hemorrhoids, irritable bowel syndrome. This is very strongly affected by our lifestyles and stress. I think one of the things that I'd like people to take home today, and women tend to do this a lot, is minimizing symptoms. You say, oh, I've had it my whole life, I'm a nervous person, so they attribute symptoms of abdominal cramping or even rectal bleeding. I had hemorrhoids diagnosed when I had my children, so it must be that, and they ignore them. And those could be very important symptoms that you would want to tell your doctor that could signal that there's something wrong with your colon. You could have colon cancer or polyps or something that could be taken care of easily.
Okay, this seems kind of unreal, but people are sending invitations for colon screenings?
Yes, there are a number of tests available nowadays that are minimally invasive or non-invasive, actually, that you could take at home just by sending a stool sample. And I've heard that those are being put in the mail. But I think if you receive one of these things in the mail, don't think that that's the easy way to do it. Just talk to your doctor about it. Just take it to your doctor and discuss whether that's a good test for you. Colonoscopy is still the #1 recommended way of screening. Not only it is the most sensitive, it can also take care of the problem right there and then, so you can diagnose and treat the problem.
And it's not painful.
It is not painful. It's absolutely painless. We use anesthesia, which is very safe. Just like we were talking about a moment ago, it's the best sleep you've ever had. That's what most patients say. So don't be afraid of that. It's a really safe test, and it's important that it's done.
Yeah, absolutely. And we talk about the importance of some of these tests and medications that you may need after you find out about a diagnosis for something. Joy, you can tell us about a prescription drug card that is available for who has to get this? Who can get it?
Sure, absolutely. And this is the biggest dilemma. I always say the same scenario. You go to your physician, you have your visit, and then you pay the copay, whatever fees are associated. And then as you're headed to the pharmacy with prescriptions in hand, you're wondering, how much are these going to be?
Right.
And unfortunately, too many times, the price is a shocker.
Right.
And what can you do? The Georgia Drug Card is a free prescription assistance program that we offer. And you can go to georgiadrugcard.com to download it. It's endorsed by the Medical Association of Georgia. And the good thing about it is every time it's used, a portion is donated to Children's Miracle Network. So in this area, it goes to Children's Healthcare of Atlanta.
Okay, so once again, that card is what, $1,500, $2,000? How much to get that card?
Absolutely free. And we collect no personal information, completely HIPAA compliant. It's a free program for everybody to access.
Don't have to be in a certain bracket, age. Anyone can apply.
No, and you can also go to our app. We have an app as well. You can download that and just take it to your pharmacist, and they'll be able to help you. Savings up to 75–80% on a lot of prescriptions.
Yeah, because some medications are so expensive, as you know.
Absolutely. We have been using it. In our group, we've recommended to patients that need medications that are now very, very expensive, and we have seen the benefit of using these cards. So talk to your doctor about it too. I mean, that's the key. Just if you don't know enough about it, don't be afraid. Just talk to your doctor about it, and we can help you with that.
I love it. Dr. Harkin-Joy, thank you so much.
Thank you for having us.
And thank you for joining us for this edition of Public Affairs on Peach. Be sure to like Public Affairs on Peach on Facebook. There we post our upcoming episodes and ask for some of your feedback. That's it for this week's edition on Peach. We'll see you back here next Sunday morning at 11:30 a.m. Have a great weekend.